Hello, everyone. This is Nurse Practitioner Katina Kennedy back with your health tips for you. Today, I'm going to talk about allergies. I have that in mind. That's a very important topic to discuss because that's the cause of most persons' chronic sinus infections. People wonder why they keep getting sick over and over again despite getting antibiotics or antivirals, but they still keep getting sick over and over again. Well, let's explain everything. When you have allergies, you're allergic to things in the environment, whether it's trees, it's dust, mold, your dog dander, your cat dander, and many of you all have pets. So if you're allergic to these things, then if you don't do anything to protect yourself or to block those histamines from re-triggering allergies, then you're going to constantly get sick. So some things that you can do to help prevent the flare up of your sinus infections that you may get frequently, or just your allergy outbreak. Some things that you can do is basically take like a plain Zyrtec or Claritin or Allegra once a day. The reason why is because that's an antihistamine that will help block environmental allergens. If you don't take anything, what's going to happen is your body's going to produce more mucus. When the mucus increase within the ears, nose, throat, just the sinus cavity, the mucus stays there. Once the mucus stays there, guess what? Bacteria can start to grow within the mucus. So if you don't get rid of the mucus, bacteria is going to constantly come and go. Hence, that's why when you take the antibiotic, some of your symptoms may disappear, such as like the headache or dizziness, the fever. But then guess what? You'll still have that postnasal drip, that dry cough that you may experience. You'll still wake up stuffy nose, runny nose. You'll still wake up with the scratchy throat, the watery eyes, the itchy eyes. All of those are signs of allergies. Sometimes it also affects the lungs as well. Some people just feel like that chest tightness or some wheezing. They just don't feel right when they breathe. All of those can be signs and symptoms of just reacting to environmental allergies. So again, using a nasal saline every day to help clean the nostrils. It helps get rid of because when bacteria or viruses, when they enter into our body, a lot of times they enter into the nasal cavity in your nostrils. So just doing preventative care such as using the nasal saline once a day or twice a day will help keep and prevent the bacteria or things from entering to the nostrils. So that's one thing that you can do. Also, you can see your healthcare provider about maybe using a nasal steroid. Sometimes that helps. What that will do is that'll help decrease the nasal turbinates, because we have turbinates on the inside of our nostrils that swell. So when they swell, that will help, that will keep the mucus stuck behind. Your turbinates are here. So the mucus is going to stay behind that and it's going to become thickened. That's why sometimes you may have the runny nose or the stuffiness because you're swollen here. So the nasal steroid just helps shrink those turbinates and allow the sinuses to drain appropriately. So nasal saline, nasal steroid, and again, just taking a plain antihistamine daily will help block environmental things. And then also you can use like a more natural things such as air filter in your home, in the room that you stay in most of the time, using hypoallergenic bed linen and things like that. So that's just a couple things that can actually help prevent the reoccurrence of sinus infection. You constantly from being aggravated from allergies. So implement some of those tips. And again, if they continue, if they don't resolve, you want to make sure that you always consult with your healthcare provider, because you actually want to know what you're allergic to. And that can help you. Also, if you do have allergies and you already take Claritin sometimes and it's not working, sometimes it's good to switch. The body can kind of get immune to just that one medicine that you've been taking for years. So go ahead and switch to the Allegra. Go ahead and switch to the Zyrtec. The Zyrtec can make you sleepy at times, so that's why I educate my patients to take that at night to help as well. So again, it's good to switch up your antihistamines as well. All right, that'll do it for today. I'll see you next time. Again, remember some of those tips I told you that can help prevent your chronic sinus infections that you may get or just reactions to allergies. Have a nice day.